really important reporting there from Kate Stafford, National Investigative Race Reporter at the Associated Press. We thank you for coming on. Good to talk to you.
Thank you.
Well, to talk more about this issue now, including from a medical perspective, I'm joined by Dr. Doe Katessa. She is an obstetrician, a gynecologist at the University of Maryland Medical Center. She's also on the faculty at the University of Maryland School of Medicine. And we're also joined by Dr. Beo Curry-Winchell, who is a medical director, physician and public health communicator based in Reno, Nevada. Welcome to you both. Really great to have you on the program. Now, before we talk through the causes and what you think needs to be done, I really want to talk about how women you look after are feeling. And I'm sure that they are aware of these alarming numbers. I just wonder, do you hear Black women, women from minority backgrounds, being worried, essentially, about what could happen to them during their pregnancies? First to you, Dr. Doe.
Yes, thank you for having me. And absolutely, I hear from my patients regularly, Black women, and especially that they are scared and they are afraid. When you see these statistics that Black women are 3 times more likely to die, it's very frightening, and patients are expressing those fears to me.
And to you, Dr. Beo, what do your patients, tell you about their experiences, their fears in a country where, they are cognizant of the fact that they are 3 times more likely to die from pregnancy-related causes?
Well, when you think about the historical fear that has been a part of the medical system, and then when you talk about giving birth, which is such an important piece of healthcare and such a vulnerable time in your life, and my patients continue to say, even before getting pregnant, thinking about getting pregnant, there is a fear of, should I even do this? And so when you look at that, that shouldn't even be a part of the thought process when you are deciding to create a family.
And yet, you're hearing these kind of comments. I just wonder, Dr. Katessa, whether you're also hearing those kind of concerns, that women are actually coming to you saying, I'm concerned about starting a family, for example, due to these adverse health effects.
I think it's a combination, absolutely, of these adverse health effects and the high rates of maternal mortality, as well as morbidity. So the complications that many women experience, particularly Black women, there's a tremendous fear about that as well. And so patients are expressing that they are concerned about starting a family, about potentially expanding their family, particularly about the statistics, and also, I think, based on their experiences that they've had within the healthcare system in the United States, the discrimination that they've experienced, the lack of trust that they feel in healthcare providers in the United States. And these are all impacting their decisions about planning for their family.
And you will have just heard from the investigative reporter who we were just speaking there, Kat Stafford at the Associated Press, and she said that, often these outcomes were being put down to physical differences, which, may play one part. But one thing I know that you've touched on, Dr. Katessa, in the past, it is weathering, essentially how long-term discrepancies in the health system can result in poor birth outcomes. Just tell us more about that.
Yeah. And so I think where this is really important to take into account, when you look at the statistics and you break down by socioeconomic status, Black women of high socioeconomic status or who are college educated or greater have actually higher maternal mortality rates than white women with less than a high school education. And we should be appalled by any woman dying, but those statistics, what it highlights is that poverty is not only at play here. And you brought up weathering, which is thought to be a factor in this, where chronic stress from discrimination for years and generations is having an impact on the health of Black people, and in this case, Black women in this country, increasing the risk of hypertension, diabetes, actually affecting the DNA that causes premature aging in Black people because of discrimination. So it's having tremendous effects.
And Dr. Beo, we were just talking there about the generational impact. Have you also seen kind of generational mistrust filtering down as well?
I have. When we think about how we are disproportionately Black people for affected by certain diseases that we hear about. Well, we have to take a step back and think about why that may be happening. And when you look at the fact that there's this mistrust, which leads to the inability or not wanting to go in and access care or seek out care, all of those pieces are really important. And another piece I want to talk about, as we talked about how social economics do not play a role, as a physician, I had this happen to me. And so it really highlights that even someone who has the education and is stating something is wrong and understands that something is wrong was dismissed.
Well, that's really interesting that you're able to tell us more about your own personal experience, someone with your education, with your medical professional knowledge. Just tell us more about how, for example, it's not necessarily about, or it isn't about physiological difference. It's about pain and people being listened to and pain being taken seriously.
Absolutely. When you look at first about race, you have to think about that it's a social construct. It's not biological. And so when you have a group of people, of Black people who are dying at a higher rate, it's structural racism, it's unconscious bias. And for me, I knew after I had come out of my C-section that something wasn't right. I didn't feel the same way I did after my first one. And I shared that with my nurse. And she said, Bio, you're fine. Your vital signs look fine. And I knew I was in pain and something was amiss. And I wasn't able to speak and do all the things that I normally was able to do after the first C-section. Well, shortly after that, my husband ended up calling my colleague, my OB, and stated something's wrong with Bio. Come back and check on her. And so I was taken back to the OR because he recognized that I wasn't myself. I was bleeding internally and I had to be transfused and I was hospitalized for 2 weeks. So when you take note of that happening from someone who is a medical director, a physician, but in the end, I was a Black woman, just like everyone else that is impacted by these statistics.
Well, that is a horrifying experience, and we're grateful for you sharing it. Dr. Katessa, something I want to just ask you about is, often women are told to advocate for themselves. But is this just about women advocating for themselves? Isn't this also about medical professionals listening?
Yes, and I would say more so, the burden should be on healthcare professionals, the medical community, to change. This burden shouldn't be borne by Black women, by patients. Our job is to care for people. And so really there needs to be more conversations, more policy changes, more education, and to really change and affect the bias that is affecting Black women in healthcare. And so the burden really is on us as healthcare providers, as physicians and the healthcare system to change these statistics and decrease this disparity and decrease maternal mortality in the United States.
Well, Dr. Katessa, Dr. Curry-Winchell, do stay with us because I want to take a little look now at a case study. One state focused on the maternal mortality rate is New Jersey, which previously had one of the highest maternal mortality rates in the United States. And earlier, I spoke with Tammy Murphy, the First Lady of New Jersey, who's been working to dismantle those disparities within her state. Well, thank you so much for joining us here on BBC News to talk about a topic which I know that you are very focused on, and the recent tragic news of the death of sprinter Tori Bowie while 8 months pregnant has really brought attention to the alarming state of maternal mortality in the United States right now, particularly among Black women, America now being the most dangerous place to be pregnant or to give birth in high-income countries. Why aren't doctors more focused on this?
Wow. Well, first of all, thank you for your interest in this. And, I think that with Tori, it's enough is enough. We've seen this, and she is one of 4 who were competing and won the gold in the 2016 Olympics in the 4x100 meter. And 3 of those 4 have had life-threatening maternal problems, if not death now. So we have to focus on this. Why are doctors not focused on it? This is a systemic problem across the country. And it comes down, I hate to say it, but it's systemic racism. There are instances where women are either too nervous, too scared to complain or to raise their voices on the one hand, because they don't want to come across as being difficult. On the other hand, they are not taken seriously and they're sometimes dismissed. And when you have, people like Serena Williams or Beyonce, who have also nearly died delivering babies, who have incredible platforms, you have to accept the fact that something is really wrong and it needs to be addressed.
Well, as you just mentioned there, we have a situation in this country when black women are 2.6 times more likely to die in childbirth, during pregnancy or thereafter than white women. The disparity is incredibly stark. What needs to be done to tackle this, to address this?
So there has to be transformational change. And when I say that, it's everything from workforce development to access to care, to transportation, to education. It's literally going to touch on every aspect of life. And I would say that in this instance, there are many things we can do. Some cost a lot of money, and some are absolutely common sense. We in New Jersey started something called Nurture NJ back in 2019, and that was really to raise awareness and to also correct the scourge that we have here in New Jersey. You just talked about 2.6 in terms of differential in New Jersey. According to data from 2016 to 2018, Black women were nearly 7 times more likely than white women to die. And Black babies were 3 times more likely than white babies to die before their first birthday. When my husband came into office, we were 45th in the country in terms of maternal mortality rates. We then slipped to 47th. We, as of yesterday, it has been set that we are now 29th. So we're definitely moving the needle. There are policy changes that one can make. We have a Nurture New Jersey plan that we unveiled in 2021 that has 70 different action steps, of which we've already tackled over half of them. And it's obviously showing that we're moving the needle here. And I would say that I could highlight 3 that are really important, and we know that they have really made an impact. One is we are the 3rd state to provide Medicaid reimbursement for doula care. But we are the only state to both reimburse and grow our community doula workforce. And this provides culturally competent care, and it's been proven to move the needle in this space. Secondarily, we expanded Medicaid coverage to 365 days postpartum, but we also have increased our Medicaid rates for for reimbursing our entire perinatal workforce to 100% of Medicare rates. This means that not only do all mothers have equity in terms of their health care, it means more providers will take Medicaid coverage, and that means less waiting times for the patients.
One thing I do really want to ask about as well alongside those measures is the fact that the United States is a country where there is no enshrined in law mandatory paid maternity leave. And I just wonder whether you think that is also damaging to women's health.
Yes, I guess the short answer is yes. And the reason I would say that is that, most of the deaths happen after delivery. Most people think this happens at delivery. It's not. It's after delivery. And so when women go home, you don't know what they're going home to, and you don't know if they're going to go right back to work, if they're going to follow up on their appointments. Babies are seen multiple times in the first 6 weeks of birth, and mothers aren't seen until the 6th week of birth. And we are addressing that in New Jersey as well with the most robust universal nurse home visitation program. So yes is the answer.
And so, First Lady, you've outlined some of the steps that New Jersey has been taking to tackle this. What more does the administration need to do, though?
Just so you know, I've been working on this for 6 years in New Jersey. We've made tremendous strides over the past 6 years, and we're having all sorts of benchmarks. I already talked about America's health rankings and where we are now 29th. The March of Dimes also recently came out with a report that showed the improvement across the country in terms of reducing preterm births. They looked at 53 states and territories, and of those 53, 47 declined. 1 remained the same. and 4 improved. And New Jersey is one of those 4. So we definitely have a secret sauce, and we will continue working on this.
First Lady of New Jersey, Tammy Snyder-Murphy there, also an advocate for women's health. Thank you for joining us here on BBC News.
Thank you, Helena.
Well, back to our panel now. Dr. Doe Katessa, she's an OBGYN at the University of Maryland Medical Center and also on the faculty at the University of Maryland School of Medicine, and Dr. Curry-Winchell, who's a medical director, physician and public health communicator based in Reno, Nevada. So, talking about how this whole issue should be tackled. I mean, we were just hearing there from the First Lady of New Jersey on the issue. Are those some solutions that you think could be implemented more broadly to you, Dr. Curry-Winchell?
Yes, I think this is a great step in, finding ways to increase access. But we also can't forget, with that access, as we talked about, it's all social economics. So we have to lean into, what are we doing to invest in unconscious bias, meaning these kind of thought processes that Black people don't feel as much pain? As we mentioned, a recent study in 2016 highlighted that. So we have to, of course, look at expansion for certain insurance as far as Medicaid, but we also know that commercial insurance, all social economics, are impacted by this. So more work to be done, but this is a great step.
Well, on that issue, Dr. Katessa, to you, I mean, I just wonder, are you seeing younger medical professionals, learning, being trained to understand implicit bias? And how can they reach people who have been in perhaps the medical profession for a much longer time?
Yeah. I think this is one of the things that has changed a lot since I was in medical school. We didn't talk about health disparities very much or unconscious bias. And now at most medical schools, including where I am, that's part of lectures and discussions from first year of medical school. And I've participated in panel discussions as part of the curriculum for our medical students. So that is a change that has occurred. But as you said, we can't just focus on our learners, because we need to focus on physicians who are in practice right now. And so that's some of the work that I do as director of our diversity and inclusion program in my department, is educating, is having conversations, is working with people so that to get all of us to confront our own biases. We are human, we have biases, and it's important that we learn to understand them, to acknowledge them, and that's how we can work to overcome them. And I think one of the other things that needs to happen is increased diversity in the physician workforce. 12% of the population in the United States is Black, but only about 5% of physicians are Black. And so it's important to have greater diversity as well.
Well, ladies, thank you both so much for being with us. Dr. Katessa, Dr. Curry-Winchell. This is a really important conversation to have, and I want to thank you for having it here on BBC News. And remember,